Welcome! In this section, we will be discussing beam restrictors and the different types as well as their applications. Beam restrictors are essential in creating diagnostic images as well as decreasing patient dosage.
We will first be discussing beam collimators. A collimator is considered the best type of beam restricting device available in radiography. A collimator is composed of 2 or 3 sheets of lead shutters which can be located below the X-ray tube window. The use of a beam collimator is referred to as collimation. Collimators affect the number of X-ray photons reaching an image receptor as well as a patient. Increasing collimation decreases the number of photons that strike the patient, also decreases the amount of scatter radiation that is produced, and reduces the quantity of scatter radiation. In return, radiographic contrast increases. If collimation is decreased, the amount of scatter radiation increases and contrast decreases.
Aperture diagrams are another type of beam restrictor device.
An aperture diaphragm is a flat sheet of metal, usually made of lead, with a hole in the center, and that it is attached to the X-ray tube port. This is most likely the most simple type of beam restrictor. Aperture diaphragms are also commonly used due to their ease of use. Due to their proximity to the radiation source, there will always be an area of unsharpness surrounding an image. Therefore, its use is not as popular as other types of restrictors.
Cones and cylinders are another type of beam restricting devices.
Cones and cylinders are circular aperture diaphragms with metal extensions. A cone has an extension that splits with the upper diameter smaller than the bottom end. They can vary in length and can be shaped as either a cone or a cylinder. Cones and cylinders are easy to use as they slide into the tube directly below the window. They also decrease the unsharpness of a radiographic image. However, they are limited in sizes and they are not always interchangeable among tube housing. Cones have a disadvantage compared to cylinders. If the angle of the flange of a cone is greater than the angle of divergence of the primary beam, the aperture diaphragm of the cone is the only metal restricting the primary beam. Therefore, cylinders are more useful than cones.
In addition to beam restrictors, there are also ancillary devices that are designed with a specific purpose.
Examples of these ancillary devices include lead blockers and lead masks, which are made to be used during a specific procedure. A lead blocker is a rubber sheet with an interior lead that can be modified to different sizes and shapes. These blockers are placed on the radiographic table to absorb the scatter produced by a patient's tissue. Lead blockers are very beneficial during the examination of bariatric patients due to the fact that scatter increases with the size of the patient. Lead masks have similar properties, but these are usually cut to fit a particular field size and it is attached to the end of the collimator. These are mainly used during cerebral angiography to remove scatter radiation and improve image quality. So in review, beam restrictors are essential tools in diagnostic imaging. They help provide the best possible image. They reduce scatter and they reduce radiation dosage to patients.
In conclusion, beam restrictors are essential tools that are used in diagnostic imaging by technologists all over the world because they help people provide the best possible image and reduce the amount of scatter radiation reaching an image receptor as well as decreasing radiation dosage to a patient.